when it comes to company building, we oftentimes don't bat an eye when it comes to splurging on the latest SaaS software or consultant, yet we willfully neglect investing in the most important hardware and software of all, which is our biology.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Jacob Peters, co-founder and CEO of Superpower. In this episode, we talk about the company's preventative healthcare platform. Jacob shares how a personal health crisis led him to start the company. Plus, we talk about productizing healthcare, democratizing concierge medicine, and building a consumer longevity brand. Let's get into it. Today's episode is brought to you by EGYM. EGYM provides fitness and health facilities with smart workout solutions built on its ecosystem of hardware, software, and partners. But it's more than cool tech. Their connected training experience delivers business results while helping members reach their wellness goals. If you run a gym, health club, YMCA, or any kind of fitness facility, you should check them out. Visit egym.com to learn more. Hi, Jacob. Welcome to Fitt Insider. Thanks for joining us.
Excited to be here.
Yeah, looking forward to chatting. You got a lot going on with Superpower and also an awesome kind of background in entrepreneurship and startups. So yeah, just to kick us off, could you introduce yourself and tell us what you're working on?
I guess quick backstory. I've been building a body of knowledge in sort of the frontier medicine space for the past 15 years. So quick backstory. I had a mother when growing up who was chronically ill, unfortunately. I don't know if, Joe, you've heard of cluster headaches.
I have.
Yeah, so unfortunately, it's a rare form of migraine that is basically, depending on the way you measure pain, worse than childbirth. And up until about 90 years ago, before drugs like morphine became ubiquitous around World War I, people that had this condition used to just commit suicide because the pain was that bad. And she was being seen by, I grew up in Baltimore, so the top neurology team at Johns Hopkins University. And all they could really do for her was give her, Band-Aid solutions, which as kind of like a teenager, when you see your mom stuck in bed for 5-6 days a week and unable to hold down a job, you start to ask questions and you get curious, right? So I ended up going down the rabbit hole and realizing from somewhat of a young age that the current way the healthcare system is architected might not necessarily have one, our best interests in mind, but number two, be sort of, there's basically an incongruence between how the body really works as a unified system versus the more siloed and pharmaceutical and surgery-based approach to solving problems that really just scratches the surface as far as what might be really going on under the hood. So I ended up doing a lot of diligence just with Dr. Google and discovered all of these integrative health rabbit holes where people were basically biohacking themselves. This was like circa 2010, so very much like pre-Huberman, Peter Attia era, before this this model of thinking was a bit more on the public consciousness. And we realized that there were all these underlying issues going on in my mom that her doctors, who again were supposedly the best, willfully ignorant. So from sort of a very formative age, there was the early inklings, planted in my brain that there's a little bit more to the story here. And then I decided to become a venture capitalist. So started a venture firm and built up a big community of founders where we help close to 1,000 founders incubate and get their companies off the ground, create a few $1 billion in private market cap, and invested in the top decile of entrepreneurs in the community. And beyond the early learnings with my mom that put me on this path, and not building software company number two or deciding to double down on the other side of the table and build a bigger and bigger venture firm, was a personal health struggle that I had to endure, where unfortunately I found myself on the complete opposite and wrong side of the healthcare incentive system. So let's fast forward to this time, June of 2021, and I find myself in Cedars-Sinai Hospital in LA dealing with a flare-up for an autoimmune disease. And the reality is, I probably, like most people in America, had little to no intelligence on what was actually happening in my body. And I made the mistake that all too common with entrepreneurs and ambitious folks, which is sacrificing your health and forgetting that that is actually the most foundational and important thing in life in favor of the pursuit of success. And this is a silent sacrifice that is all too pernicious. And something that I think is crazy thinking about all this now and in retrospect is that when it comes to company building, we oftentimes don't bat an eye when it comes to splurging on the latest SaaS software or consultant or tool to help make our business lives and like the return on invested capital more efficient. Yet we willfully neglect investing in the most important hardware and software of all, which is our biology, right? And at the end of the day, in a world where AI agents aren't yet doing all the work for us, it all starts with the human. So I'm in a hospital bed, years of lack of sleep, overwork, not taking care of myself in the right way, and I knew something was wrong the whole time. Like the body has this certain like intelligence to it, where if you're in the wrong type of relationship or business partnership, where you're working on the wrong problem or for a company that you don't necessarily feel inspired by, like your body sort of has this like visceral reaction that like it kind of knows, right? It's like kind of gut intelligence that something's not quite right. And I sort of had that sixth sense that something inside my body was not all there. But you'd go to the doctor, and you tell them, hey, I'm having some weird GI distress, or I have some XYZ, and you're effectively told that you're normal. And this is kind of the story of American and healthcare in its current state worldwide, which is we are sort of told that we're okay until the chronic disease emerges, and then the chronic disease is treated. But the reality is like things were happening at like a much lower upstream mechanistic level for years and years and years and decades before any sort of like disease or problem manifests. And that's very much what happened in my case. So the sad part is the health experience I had to go through could have been 100% prevented. And what I actually went through was 4 months of a nightmarish experience during the height of COVID, when you couldn't really have too many hospital visitors. And it was staffed with a team of doctors, God bless them, but they were given the wrong toolkits, which is emblematic of some of the problems in medicine to deal with my condition. So I was formally diagnosed with an autoimmune disorder, Crohn's colitis. Again, it's like when your immune system attacks your colon, and they try every single biologic drug on the market in order to stop this like systemic inflammation problem that I'm having. So with biologic drugs, the way they work is because they don't really know, which mechanism your body might be deploying yet to the sites of inflammation. It's a whack-a-mole game where the standard of care is let's take one of 15 drugs, Humira, Remicade, Stelara. Some listening might be familiar with these things, but they're basically, multi-deca-billion dollar drugs that are very, very common now. And you try one and see if it works for 2 weeks to reduce the inflammation. If it doesn't, it's on to the next. So they took me through, a rigmarole of like a half dozen of these different drugs over a few month period to try and stop the like systemic inflammation in my body and in my colon, and nothing worked. And again, the only options that I was ever given at my disposal were pharmacology in nature. Let's, address the kind of symptom and the Band-Aid solution with pharmaceuticals, or surgical. So after a handful of months of dealing with this, I'm told that in order to save my life, surgery is the only way. And they're going to have to permanently remove multiple of my major organs, basically everything from the large intestine down, in order to stop the inflammation, which is crazy to me after the fact. I found out it's crazy because come to find out, if you start to dig into the numbers, and in my case, I very much consider myself a citizen scientist, you realize that over like 60% of health system revenues, including the health system I was being seen at in Los Angeles, come from surgeries. So they're financially incentivized to get as much money from you as possible that they can bill for, which is surgeries. Think about how many people are in a room during a surgery, how much prep there is, how much post-surgical care there is. Like it's a massive revenue stream. So nowhere are they incentivized to say, okay, well, let's take 10 steps back and look at the root underlying issues that might be at play, which led the body to be in a place where not everything's going all right. So I was never once, just like my mother, offered any sort of root cause assessment Never once, did they try to look at the other factors that my body might need to be bolstering. Because again, the way I think about health is your immune system and your ability to fight things, whether it's like a scrape, whether it's a cancerous, cell that appears, or whether it's some sort of infection or inflammatory process. Your body basically has limited resources, right? It's like a cup that only has so much water in it. And if you do not have great nutrient balances, if you're not getting great sleep, if you're eating foods that are laden with toxins or additives that your body might not necessarily agree with, all those things are sucking up the body's finite resources and ability to deal with things. So that's what happened in my case. I ultimately, not really knowing any better, and after having been run down for close to 4 months, had to get this surgeries, and forever changed my life. And now I'm one of a few 100,000 people who has to live with this disability of missing major organs and like not being able to digest food properly. And it all comes down to a game of incentives.
And I find myself, as you're talking about it, obviously like nodding my head. And, I think anybody that has had their own health struggles or family members, my father passed away from cancer. My brother has battled cancer, and all along the way, it's just on them or on us to figure out what's going on, figure out the best course of treatment, figure out how to handle it, figure out not only all the things that are happening in the hospital as things are being diagnosed and surgery, and we need to do that, but even this idea of like, Anthony, as he's coming out of chemo, with like, here's a brownie and jello and sure, that's full of sugar. Like, this is what you should be, kind of eating now. So it's all, I think a lot of people would look at that and be like, yeah, it's crazy. It's broken. The incentives are misaligned. Then it gets to this place of like, and I'm sure you looked at it as well and thought like, which part of this, where do I even begin in terms of tackling this? So as you think about, hey, this is what I want to do next, and as you said, this is how I want to spend the next 30 years, how do you start to think about solving that problem that is so massive, from the root causes to the incentives to the hospitals to the surgeries? Like, how do you even scratch the surface?
It's part logistical and technological, but I think the bigger nut to crack here is actually cultural, right? It has become culturally normalized that cancer is something you just get, and it's genetic, right? So before we dig into a bit more technically what we seek to do with Superpower, I'll paint the picture that healthcare has never had an iconic, larger than life brand or movement that people can get behind, that is antithetical to the challenges and the brokenness of the system and all these messed up incentives that be. And we've seen similar types of movements in other industries. Let's look at the financial markets. Robinhood started 10 years ago. People were feeling very disenfranchised post 2008, the financial crisis. There was very much this like, the retail investor is basically getting screwed. The system is broken, and systemic Wall Street and corporate greed is rampant and abundant. And then a company comes along and becomes a household brand, and everyone tens of millions of Americans all of a sudden decide to take financial empowerment into their own hands. It becomes a social movement, and you see Reddit's popping up, and even like they're able to move stocks like the GameStop movement. Healthcare needs a similar hero, and it needs a similar galvanizing company, galvanizing moment. It really needs a cultural revolution and an awareness, as much as it needs logistical and technological solutions to just like functionally make it easier to be healthy. And that's one of the things that we seek to do with Superpower. And the category of healthcare is deeply uninspiring. United Health, one of the biggest companies in America, it has a negative NPS score. Like, no one would walk around in their right mind would walk around wearing a Forward Health or a One Medical t-shirt. Like, it wouldn't happen. People don't have, a deep affinity for their healthcare provider. And that's, I think one of the biggest things that we see an opportunity to do with the brand that we're building beyond the underlying technology is let's build a real community movement.
I want to come back to that point because I do think it's very important. In across the board, whether it's the Robin Hood example or, in some ways when Calm was starting, now it's kind of just like generally accepted and destigmatized. They wanted to be the Nike of meditation. And so this idea of like normalizing it and destigmatizing it, same way. So that brand piece we'll come back to. And then you mentioned technology. How does that kind of factor into how you think about tackling this problem?
So no person should unequivocally, no person in America and beyond should ever have to go through the health challenges that I endured or my mom. And unless you're like unlucky and born with some like chromosomal abnormality, or you just happen to grow up next to a Superfund site or something, and are like, unfortunately, your cells are damaged from a young age. Like, disease should be optimal. Like, we should all live as long and as healthfully and bountifully as possible, and that's something that we fundamentally believe. The other fundamental belief is that there is a better model of medicine out there, and I know this because I discovered it and I experienced it firsthand. Once I got out of the hospital, I was down 3 organs, down 50 pounds, told to eat whatever I want, which is laughable, by the way, right? The hospital nutritionists are like, you can eat all the fried chicken and pizza and ice cream that you want. And like, I kind of look at them funny, like, you guys have no concept. And I was told to medicate for life. So, given again, like another dose of biologic drugs because they didn't want the autoimmune condition to research. I decided to take my health into my own hands at that point. So, what I ended up doing was I posted about my story on Twitter and have like a little community on x.com, and a post goes a bit viral within the tech community where I'm sort of starting to share my story. And I'm very thankful that I decided to do that because as a result, I got connected to a handful of high-end concierge physicians. They're working with people who would have money and are in the know, right? The billionaire class of the world. So I ended up spending the next almost year completely off the grid, taking a step back from work and going into a monk mode of sorts, where I worked very closely with a handful of these high-end physicians who are running, longevity and functional medicine clinics around the globe, and again, treating people who have money and are in the know to fundamentally reverse their chronic diseases that we are told are uncurable, as well as verifiably, sort of improve the organ function and I'll say this colloquially, but like slow the pace of aging of major components of the body. At least by that I mean relative to other folks your age group, right? Depending on the ways in which we could measure the proxy for organ function with biomarkers, there's age cross sections you can look at and get a sense of like, cellularly, are you, depending on the way you look at it, are you closer to people your age or people a bit younger or older? So that's the way to think about it. And it's fascinating, the dichotomy between the care that I had experienced, which is one size fits all, reactive, surgical, and pharmacology first, not data driven in the slightest, and not holistic and lifestyle focused, versus care that you can receive where there's every test imaginable to get a full 360-degree view of what's happening in your body. Like, we see on social media people like Brian Johnson who are doing this to the utmost degree, with spending millions of dollars, and open sourcing their data sets and their test results. But it's not only the data you look at, it's also the tools in their disposal. So they have a much more diverse toolkit as far as the things that they're able to look at. And these high-end physicians, what they'll do if you get working with them in the right way is they'll sit down on a whiteboard for like 4 hours and connect to this gene SNP, to this detox pathway, to this nutrient level, to this symptom and patient presentation, to this event in your life from 4 years ago. Like, all this dot connection is possible, and in the brains of these elite high-end physicians, they've been honing their clinical algorithms outside of the medical system for the past 10, 20, 30 years. And that is a completely different standard. That is the model of care that helped me get to the place that I am now, which is I feel like I have gone from this horrible baseline to what I can confidently say and numerically back up is a fully healed state. I can't bring back the organs, unfortunately, but I'm a night and day difference, both quantifiably and qualitatively, relative to where I was. Now, throughout this whole experience, I found myself questioning, why do the Jeff Bezoses and the like Tim Cooks of the world use the same iPhones and Amazon.coms that they've created as everybody else, yet have access to different healthcare? Like, why should I be one of the rare few who built the right Twitter network to be connected to the right people and ultimately be in a blessed financial position based on the companies, that I've started to be able to afford this level of in-depth care. Why can't this be democratized? And the inevitable arc of technology is such that it democratizes for the many what was once only available to the few. People in the 1800s, only the very wealthy had, electricity in their houses. In the 1950s, only the biggest, richest companies had mainframe computers. Microsoft, brought everything online. Utility companies made it so that everyone has power. Black cars, same thing. Only you could afford a private driver if, you had money. Now Uber, is a phone click away. The same thing is going to happen at the high end of medicine. And, we very much believe in and seek to enable a future where every person, from the moment they're born, has the power to take health into their own hands, make the right data-driven decisions about what is going to be uniquely best for them. And ultimately, we want to expand the definition of health to be beyond what just happens in the clinic. So there's a spectrum of, what I call as healthcare to wellness. And healthcare, can be sort of defined as like, maybe what happens in a primary care doctor's office. But then there's the other 90%, right? Social determinants of health is another way of looking at it, where, your state, the way you feel, the symptoms you present with, the diseases you ultimately, end up succumbing to, it's a result of that other 90%. And no company today is helping people know about and make it easy. No companies make it easy to. No one's even aware, what that spectrum really is today in a lot of cases. So, there's basically a generational opportunity to build the world's first health super app and a platform that takes all the disjointed aspects of health today and brings it into one place to make health easy.
The Fitt Insider Podcast is brought to you by our friends at EGYM. This is an exciting partnership for us, and not just because EGYM makes some of the most innovative fitness products out there, but because the entire EGYM team, led by their CEO, Philip, is committed to making health, fitness, and well-being more accessible for everyone. And that's a mission we can get behind. By combining their smart equipment with integrated software and hundreds of connected partner brands, EGYM helps fitness facilities stand out by delivering a personalized, gamified workout experience that improves outcomes and member engagement. So if you're a gym or health club operator thinking about how to best serve your members while driving business results, go see what EGYM is up to at egym.com. When you think about that, both the opportunity, maybe some of their company's platforms, tactics that exist today, you mentioned concierge medicine, right? Having somebody that's, from this almost executive physical level to continuous tracking and experimentation and then testing and retesting, having this full kind of look into your health. I think a number of companies maybe aspire towards that goal right now, or maybe say that they do a version of that, probably not all of the in-person aspects, but this like continuous health monitoring, this sending you tests, getting you blood work, microbiome, glucose monitoring, running experiments. How do you think about like the current state of things and maybe how it's being approached, right? A company that might say, hey, we're solving that problem, or we're certainly working towards this future of like the all-in-one or digital longevity clinic, however you want to phrase it, to like how you see it and where the gap is.
Yeah. So one way to think about this is, across the board, technology is not just democratizing for the many what was once available to the few. It's leading to the death of, existing entrenched and cherished institutions and the birth of new institutions. The same thing happened in taxis in major cities, right? The Ubers of the world, and bringing taxi service online, it created a new institution that sort of, led to the fall of the taxi medallion regime. And, it's happening across the board with, people joining digital communities, becoming, almost like internet citizens in a sense, and not necessarily like, wanting to feel tethered to existing states or even nation states for that matter. And same thing is going to happen in medicine. And up until now, the ability to take health into your own hands has really been gatekept by physicians, hospital systems. And there's like approximately 30 multi-billion-dollar revenue health systems in the United States that are all like physically tethered to the real world. We certainly see a future where there's going to be 30 multi-billion dollar cloud-based, digital health systems that, don't necessarily put the doctor in front as the gatekeeper, but rather put the consumer, as sort of the driver at the wheel with all the best tools at their disposal, obviously medically guided. But that's something that we think a lot about. There's basically going to be a new era of health sovereignty where, people have more tools than ever before, and they're able to take advantage of a lot of the advances in medicine and our understanding of biology that are only exponentially growing. There's this idea in medicine that I stumbled upon called like the 17-year gap, where traditionally primary care and emergency and standard of care protocols in a lot of specialties is more or less like on average about 20 years behind the bleeding edge of the science, right? And there's a whole host of reasons for this, everything from safety to liability, which are very warranted. But also it's the fact that there's really no incentive for, a lot of physicians to stay out ahead of the research, because the way the fee-for-service system works is like they only get paid if they see patients. So, where is the time to go outside and accumulate new research and build up a 30-year body of knowledge, outside of your med school education or outside of your protocol, like these high-end concierge doctors did in my case, right? Some of these folks have like six-person full-time PhD research teams that are just combing the latest on PubMed and bringing that into their clinical models so that they can have the best protocols. It's also a question of liability, right? Like, why would a physician actually can't, because most physicians in America, because of private equity, are now working for hospital systems, and you can't deviate from the protocol, otherwise you get fired. So what we've basically done in medicine is, again, and this is not the fault of individual doctors, and I talk to doctors every day. I work with a handful on our team, and we discuss these problems at length. But it's not the doctor's fault as much as it is the fact that we put them in an impossible, intractable position to be able to perform the highest quality, most cutting edge and root cause and holistic medicine, and it's inevitably going to be behind the latest of the science. The big problem, though, is that 17-year gap, I believe, is about to exponentially widen. So the other thing that technology does is it compounds on itself, right? So it's like the exponential, it's why people are worried about AGI and us reaching a singularity point where the AI keeps getting smarter, quicker and quicker. Well, the same thing's happening in medicine, because our understanding of biology, biochemistry and how the mechanisms work in the body, it builds on itself, and that becomes an exponential runaway. So that 17-year gap is going to start to look like 60 years in a few years, relatively speaking, at least, right? And it's going to be a runaway. So what this means is there's, by and large, an opportunity for new institutions in medicine to emerge. Someone's going to build the next Mayo Clinic in the cloud and have it be a lifestyle brand that consumers deeply resonate with and cherish. But it's going to do all the things that the incentives in medicine today don't necessarily make easy or possible.
When you think about taking this, and you mentioned the maybe concierge doctors who at this point have their research teams and they're developing these protocols and they're thinking about how to be on the kind of bleeding edge of the research and science. Taking that now at this standpoint, when you think about, okay, what is the initial, so for folks who aren't familiar, we covered this in the Fitt Insider newsletter when you kind of launched more recently out of stealth and announced a funding round. Also said, hey, we have a wait list, and you can correct me on the number, but maybe 15,000 people, probably more than that now, that you're starting to onboard people. What does that onboarding look like at this point? How do you begin to develop, hey, this is the Superpower protocol, clinical research approach to building the Mayo Clinic in the cloud?
Yeah. So I'll maybe start with a bit of an anecdote from the care that I received relative to what I got in the hospitals. Again, we know the story, right? It's, hey, drugs or surgery are your only options, and we're not going to look at any of the other determinants of health, from your sleep to nutrition to what's actually happening under the surface. Now contrast that to one of the physicians that I ended up working with, and she told me point blank that she had seen a dozen people with my condition and in that level of inflammation that I was dealing with, and she'd only lost one colon. So what's going on here with this 11 out of 12 success rate? And they have the patient data, right? And they're going through an IRB, to publish this clinical data. But it's basically getting at the root cause of what's happening with someone, right? So in my case, I had super high mercury levels, like phthalate and plastic levels that were in like, the 99th percentile relative to the population. I had certain gene SNPs that made it really hard for my body to, process and absorb certain minerals from foods. I wasn't eating some of the right foods, and then it's a whole nother story about how modern soil today is, devoid of many of the nutrients that, it had even like 50, 100 years ago, just due to like repetitive farming practices. So no one's getting enough micronutrients, and no one's talking about it. One of our medical directors we work quite closely with, they say that like they believe, most modern diseases are actually just, kind of downstream of decades of nutrient imbalances. And it's very correlated with things like cancers. Like the cancer doesn't just appear overnight. Or people say that like, something like a cancer is very genetic, when in reality, the genetic susceptibility just means that like you had a gene pathway that made it hard for your body to like, absorb vitamin B1 as an example, no matter how much you ate. And that, basically meant that the pancreas was able to use less of that, nutrient resource, and therefore like the organ just couldn't fend for itself properly. So all these systematic problems, right? Nervous system completely dysregulated. My HRV was in the tanker, and I had a very dysbiotic microbiome. My intestinal lining was, what they call permeable. So, every time I would eat, I'd get brain fog because endotoxins or food particles were leaching from my, stomach into the rest of my bloodstream, and my immune system had to react to all this. So something that we've learned in building superpower is that almost all of us are fighting these battles on a micro level. And, we're all sort of diagnostic odysseys. So even if you're, going to the doctor and getting your regular blood check, you think the reality is the story is so much deeper. So the superpower membership and experience starts with what, we believe is basically the most, again, depending on your budget, the most comprehensive look at everything from microbiome to metabolome, as far as what's happening inside your body. And then we're taking the best protocols and practices from, the edge of medicine and the best physicians in order to actually, make progress and take people from this pathway of baseline health, which most folks couldn't even describe, to a fully healed state, which, we believe will allow folks to live disease-free as long as possible. And it's really, turning healthcare into a structured product problem, right? Where it's part medical and the clinical decisions you make based on the presentation of data. It's part data science and AI, which is how do we synthesize all of this data to help make sense of it. And it's ultimately part behavioral science, which is, okay, great. You gave me full body intelligence. You told me what it meant. And that, this issue that we found means you're at a very high likelihood of developing prostate issues 5 years down the line. Now let's actually handhold you to help you do it in like a really cheap, cost-effective manner, guided by technology. So that is basically the journey that we're putting people on.
Now, circling back as promised to, hey, we want to do this in a way where we build a lifestyle brand or we build a movement. On the website, you have the manifesto for thinking about how to kind of shift culture in this way. Obviously, when you look at folks like Andrew Huberman and Peter Attia and Brian Johnson, they're doing that. They're doing that through content and podcasts and self-experimentation. How do you think about doing that in a way that someone would wear the superpower hoodie around, that they wouldn't wear the United, so anything really out in public?
Yeah, so I come from a bit of an academic community background. So my first company, we were building software for community teams. A second business, we were building, a community and a venture platform for entrepreneurs. And, so I've had the luxury of starting a handful of community businesses, as well as kind of studying the patterns of thousands. And something that I've come to as far as a conclusion is that communities that survive the longest and become the most enduring and galvanizing are ones where they follow a formula. Some, I guess, communities more broadly that have followed this formula very well are actually religions. They're basically, these set of ideals and shared beliefs and community tribes that have survived for millennia or thousands of years. And there's a reason for that. It's because they check all the boxes as far as what makes the community great and a community enduring. Number one, they have icons and figureheads, right? We're already starting to see this in the popular culture with, folks like the Brian Johnsons, the Attias, and the Hubermans, kind of writing the narrative here that there's more to meets the eye, more than meets the eye when it comes to health. The other thing religions have is they also galvanize around this idea of shared struggle. It's a reason why like fraternities and sororities, have this like really strong bond. It's because you go through a hazing, or a tough time, or even early stage startup teams, right? The PayPal mafia, um, or sports team. Like as soon as you go through a shared challenge with other people, it creates a really deep and forever bond. And with a lot of religions, it's we're all fighting the shared struggle of mortality in a sense, right? And the abating of sin or doing wrong by our fellow human, or disobeying sort of the the religious canon. And I'd argue that health and this broader longevity and kind of holistic health movement has the potential to be basically a new religion in a sense, because we're all it checks a lot of these boxes. We're all sort of fighting the same shared struggle, which is our own mortality in a lot of ways. So I think that the seeds have been laid for a brand to emerge that is sort of influencer agnostic in a sense, that might work with the right kind of nodes in the broader social graph, to build credibility in a sense. But yeah, it has to come from somewhere deeper, right? Like a brand at the end of the day has to exist for hundreds of years and be agnostic to the people that started it. Nike is not tied to one athlete. Like Nike is just like sort of athletic greatness embodied. So that's something that we think a lot about, is building a very like bottoms up grassroots community, and something that we'll be doing much more very shortly later this year, once we start to toot our horn a little bit.
Yeah. So as we get toward the end of the conversation and wrap up, you think now out there, certainly talking about superpower more publicly, starting to, and I think it said something like maybe later this year, onboard folks and really scale up the platform. What should listeners look out for? What are you excited about? Kind of how does the rest of the year play out?
Yeah, so there's a lot to build. We're excited to get people off the wait list as soon as possible. Right now, we're bringing in a few dozen a week. In 5 years, we want to have helped millions of people take better control of their health. So you'll be hearing from us much more very soon. And just shoot me a message if you want to get off the wait list and you're really excited. We love eager beavers, and building with our most excited members.
Awesome. Is it just superpower.com? Where's the best place to learn more? Social website? Where would you point people?
Yep, superpower.com, or you can find us on Twitter at twitter.com/superpower, or you can just shoot me a message on Twitter. I'll put my social link in the show notes.
Awesome. We'll make sure all that's linked up. And thanks for making some time to chat about it today. We're excited to see how the next rest of the year plays out, but also, as you put it, the next 30 years of working on this very important problem.
Thanks, Joe. Really appreciate it.
One more thing before you head out. Help us spread the word. Take a minute to rate and review the podcast, subscribe to the YouTube channel, or share this episode with a friend. And if you like conversations like this, you'll love the Fitt Insider newsletter. We send it every Tuesday. The link is in the description. Thanks again for listening. We'll see you back here next week.